To understand strep pneumo and strep viridans. Strep pneumo is more dangerous than the strep viridans. First point is this. So both strep pneumo and both strep pneumo and strep viridans are gram positive. It means they take up this purple stain. They are alpha hemolytic cocci. Cocci is the shape, right? Alpha hemolytic. I will explain you what is this. So when I say alpha, if I say alpha, it means there must be some beta, there must be some gamma, there must be some beta, right? So what is hemolysis? First of all, hemolysis is just blood breaking, right? Lysis of the RBC, how bacteria can affect your RBCs, right? So it's just a measure of how your bacteria can grow on blood agar, okay? So that strep pneumo, they are hemolytic, it means they can grow well, okay? And alpha means that they do this partial breakdown of hemoglobins, right? Beta means they completely destroy the RBC, okay? And gamma, it means they have no hemolysis, okay? It means RBCs are okay with them. And for example, enterococcus fascicalis, right? Some type of, they are gamma hemolytic. It means they do not mess with RBCs. Alpha hemolytic, it means they partially break down they partially break down your RBC. So what happened here, how the hemolysis happen is that bacteria, it oxidizes hemoglobin inside the RBCs, right? And it creates this methemoglobin, right? Which a lot of kids have, right? A lot of newborns they have, right? So RBCs are not fully lysed, but they convert RBCs into methemoglobins, and this is how it happens, right? And beta hemolysis is just they destroy it. And hemolysis, how it happens, hemolysis here is that there is complete rupture of RBC membrane, and just hemoglobin is just released into the serum, and that's how it happens. Okay, so beta hemolytic, these are like S pyogenes, right? Okay, so let's get back to the topic. The topic is strep pneumo and strep viridans. So both are gram positive, right? But strep pneumo is primary and viridans is opportunistic. Okay, so primary, it means that it can cause some serious infection, and viridans it's an opportunistic. Once you have these kind of infections, viridans will be like, okay, let's come into the play. Now, if you really think why why the strep pneumo is more aggressive than the viridans, it's just both are alpha hemolytic, right? So where they normally live is this means here in Russian, sorry. So what happened here is this bacteria called viridans, yes, this one. They usually are the normal part of your GI tract, right? And they usually live in your buccal cavity as well. And they are opportunistic because that's why they can, they are opportunistic because they live in this buccal cavity for years. And once you have some sort of problem in your mucosa, they can leak into your submucosa and cause problems. Strep pneumoniae on the other side, pneumococcus, whatever you want to call them, they also are present in nasopharynx, right? And what happened here is that they are primary pathogen, right? They invade tissue, even in some healthy host. Okay, so I hope we are able to understand this conceptual difference between strep pneumo and strep viridans. Okay, so strep pneumo, it is encapsulated. It means it's more dangerous. It means it has a capsule around it, and this capsule is made up of polysaccharide capsule, right? And it's a sugar capsule, and it is slippery for phagocytosis. So this encapsulation is a virulence factor for strep pneumo. Other thing is that they are optochin sensitive and bile soluble. Bile soluble is when they can survive in your intestine, they can survive in your duodenum. Optochin sensitive. So what I mean here is this. Here, what I really mean is this. What is optochin? Okay, so the correct name is optochin, right? And it's actually a very big word. I don't remember. So it's just a chemical compound, and it's used in microbiology. And what happened here is that this optochin, it stops the growth of streptococcus pneumonia, okay, but it cannot stop the growth of viridans. So that's how we can differentiate between viridans and pneumo, okay. So what actually it does is that this optochin, it stops the ATP synthesis in the bacteria, right? Especially this proton pump, okay. It's like it is a inhibitor of proton pump, okay. So but okay, why viridans then survives? Because what happened here is that this streptococcus pneumonia, ATPases, right, this proton pump, right, is very sensitive to this optogen, okay, and the growth stops, right. But viridans, on the other hand, is resistant, and they grow right. They have this selective chemicals. What do I want to say? Uh, this viridans, right? They are resistant to optogen. That's what I'm trying to say. That's it. So this is like just a way to differentiate. Okay, so strep pneumo can cause lobar pneumonia. Okay, rust color sputum, right? Because inflammation causes RBCs to leak into alveoli, and that gives us rust color. And so lobar means whole lobe is affected, right? And this lobar, this becomes consolidated, and consolidation leads to pus formation. Okay, other fourth point is MOPS and IgA protease. Okay, what here I'm trying to say, what I'm really trying to say is that this factor called IgA protease, they have this thing, and what happens is that they can chop up your IgA, and we know that serosa is covered by IgA, right? So that's why they are really, really aggressive, right? Because they are the prime, they are the prime criminals of they are really aggressive. That's why, because they have IgA protease, they can attack your serosa, okay. And once you attack the serosa, you can lead to itis, inflammation of this serosa, and MOPS means meningitis, otitis media, and pneumonia and sinusitis. Like one cause, strep pneumo can cause all four of them. Other thing is that they can, in sickle cell disease, spleen is damaged, of course, and normal function of the spleen is to remove these encapsulated bacteria. But if you already have sickle cell disease and you don't have a good spleen that is removing this sickle cell RBCs, right? And what happens is that you don't have spleen, so what happens is RBC won't be able to remove this strep pneumobacteria, and just you don't have spleen is damaged, and I mean you have a damaged spleen, so it's a you can't clear this strep pneumo, and this is what happens. What I'm trying to say is that, I mean, spleen has two roles, right? Filtration, right? Removal of these bad RBCs, and immune activation, that is like this IgM growth, right? So what happens is the sickle, that we have this sickle's disease, and this RBCs have this sickle shape, right? So spleen is supposed to remove that. Spleen is present anatomically, but it is functionally absent. So in sickle cell disease, right? And here what happens is that we cannot like remove these RBCs, and spleen is supposed to remove this bacteria, right? So this is the whole story of it, right? What about the vaccination strategy? Now, because these bacteria are encapsulated, right? Their capsule is made up of this sugar molecule called polysaccharide. They do not, elicit or maybe show a very strong immune response in young children. So modern vaccines are these conjugate vaccines, right? And what do I mean by conjugate vaccine? They are like capsule polysaccharide with protein carriers in it. Okay, so this is how they induce strong T cell dependent memory. So that, because it's a conjugate vaccine, okay, it has protein and it has a this encapsulation on it. So that's how it works. Okay, what about strep viridans? Strep viridans is this brother of strep, which is less, less dangerous. Okay, it's not encapsulated. It can be cleared by spleen. That's why viridans does not cause pneumonia or meningitis. Dextran viridans. Okay, let's read about it. So viridans, right? This bacteria. So what happened here is that glucose to make sticky and slimy substance called dextrans, right? Viridans uses this glucose to make a sticky and slimy substance called dextran. They make this substance called dextran, and this is why viridans can stick to the damaged heart valves for years, or to dental plaques, right, for years. So they make this thing called dextrans. So imagine viridans with dextrans, and dextrans is dexter. So I hope we remember that. Subacute bacterial endocarditis. So a person with damaged heart valves goes to dentist, right? And dental cleaning is happening. And so what happens is the viridans goes from mouth and enter into bloodstream. And this is why viridans can cause dextran glue forms, slowly growing vegetation, right? If you open your Google and you search vegetation on heart valves, you will find some sort of this vegetation, and we call this thing as smoldering infection. Now this is why we have this subacute and bacterial endocarditis, which is usually done by viridans, because viridans has been living there for months and months and months, because it has something called as dextrin. So that was strep pneumo, that causes meningitis, otitis media, pneumonia, sinusitis, that is, MOPS, and it has IgA protease, and it has it's sensitive to autochin, right? Optochin. And viridans is, sensitive to this what is this called? So strep viridans is sensitive to penicillin G or ampicillin. Okay, so that's important right there. Okay, so it's also sensitive to vancomycin. Usually, I mean, if any bacteria is resistant to penicillin, we usually go for vancomycin or ceftriaxone. So we understand this concept of strep pneumo and strep viridans. That's it.